We need an urgent reversal from the majority of vaccines going to high-income countries to the majority going to low-income countries. WHO is calling for a moratorium on boosters until at least the end of September to enable at least 10% of the population of every country to be vaccinated. Even while hundreds of millions of people are still waiting for their first dose, some rich countries are moving towards booster doses. So far, more than 4 billion vaccine doses have been administered globally. More than 80% have gone to high and upper middle income countries, even though they account for less than half of the world's population. I understand the concern of all governments to protect their people from the Delta variant. But we cannot and we should not accept countries that have already used most of the global supply of vaccines, using even more of it, while the world's most vulnerable people remain unprotected. In late May, I called for global support for a sprint to September to enable countries to vaccinate at least 10% of its population by the end of September. We're now more than halfway to that target date, but we're not on track. When I issued that challenge in May, high-income countries had administered around 50 doses for every 100 people. Since then, that number has doubled. High-income countries have now administered almost 100 doses for every 100 people. Meanwhile, low-income countries have only been able to administer 1.5 doses for every 100 people due to lack of supply. We need an urgent reversal from the majority of vaccines going to high-income countries to the majority going to low-income countries. Accordingly, WHO is calling for a moratorium on boosters until at least the end of September to enable at least 10% of the population of every country to be vaccinated. To make that happen, we need everyone's cooperation, especially the handful of countries and companies that control the global supply of vaccines. The G20 has a vital leadership role to play, as the countries that are the biggest producers, the biggest consumers, and the biggest donors of COVID-19 vaccines. It's no understatement to say that the course of the pandemic depends on the leadership of the G20. I repeat, it's no understatement to say that the course of the pandemic depends on the leadership of the G20 countries. 1 month from now, the G20 health ministers will meet ahead of the G20 summit in October. I call on them to make concrete commitments to support WHO's global vaccination targets. We call on vaccine producers to prioritize COVAX. And we call on everyone with influence, Olympic athletes, investors, business leaders, faith leaders, and every individual in their own family and community to support our call for a moratorium on booster shots until at least the end of September.